I'm Dr. Mohammed Waqas. I work with CHIS and Vincent Heart Institute. I'm specialized in advanced congestive heart failure and pulmonary hypertension. Causes of pulmonary hypertension. We have to understand that heart has two sides, right and left. The left side is the main pump that pumps blood to the whole body. After giving oxygen, it comes back to the right side, and the right side pumps blood into lungs. Even though both sides of the heart are together, they still supply two different circulation systems, and that is why the blood pressure in these two systems is totally separate. Just like we put a cuff on our arm, we get a number 120 over 80, that is our blood pressure. Unfortunately, we cannot really put a cuff on the lung itself and figure out what the blood pressure is. That is why the blood pressure in the lung has to be calculated in a totally different way. Moreover, the blood pressure in our body and lung has totally different values. Lung is a low resistance pressure system, so pressure or blood pressure in lung circulation is way lower than the normal blood pressure that we get once we put cuff on our arm. One way to measure blood pressure in our lung circulation is by doing an echocardiogram, putting an ultrasound just like regularly do to check for heart function. We put ultrasound probe on the heart and estimate what the lung pressures are. Based on those lung pressures, we can tell if they're high or low. Hence, echocardiogram or ultrasound of the heart is an absolute screening tool, not a diagnostic tool. It gives us a clue what could the possible cause be, but it does not diagnose pulmonary hypertension as a disease. Hence, we use echocardiogram as a screening tool. Once we know the lung pressures are high, then we can go into more detailed diagnostic steps of figuring out what those lung pressures are. And the most common diagnostic step that we use is doing a right heart catheterization. The word catheterization can sometimes be confusing because people think it is looking for blockages. Actually, it's not. Right heart catheterization is primarily meant to estimate and diagnose and measure lung pressures which could be high. We put a small catheter from groin or from neck and float a catheter that goes up heart and lung circulation. Now, based on those numbers, we confirm if patient has a component of the right side or left side heart disease, lung disease, or actually a systemic disease, a general body disease, which could be leading to pulmonary hypertension. Hence, over time, World Health Organization has come up with 5 distinct categories of pulmonary hypertension to push patients in specific groups because based on the group, the treatment strategies can be completely different where the patients fall.